So what is the relationship between hypothalamic dysfunction and chronic fatigue syndrome? Let's talk about it. Hypothalamus dysfunction is defined as alterations in hypothalamic function that affects circadian rhythm, weight management, metabolism, hormonal balance, adrenal function, thyroid function, glucose metabolism and insulin resistance, sleep and circadian rhythm, and temperature control. And one of the biggest roles of the hypothalamus is to direct metabolism, particularly cellular metabolism and mitochondrial functioning. And at the heart of chronic fatigue syndrome is mitochondrial dysfunction. While triggers may be toxins, infectious microbes, or nutritional deficits, research is now showing that hypothalamic dysfunction is associated with chronic fatigue syndrome. One way to diagnose hypothalamus dysfunction is a cortico-releasing hormone challenge, which tests the adequacy of the hypothalamic pituitary adrenal axis. Typically, chronic fatigue syndrome patients have mild central adrenal insufficiency, yet hydrocortisone supplementation reduces fatigue in very few patients, suggesting that the HPA axis dysfunction may be a physiological adaptation to universal mitochondrial dysfunction. In my 35 years of clinical experience, all of my chronic fatigue patients show signs of hypothalamic dysfunction. Supporting the hypothalamus nutraceutically to optimize hypothalamic function helps correct HPA axis issues, adrenal insufficiency, and increases mitochondrial function, which translates to more energy, less fatigue, less brain fog, less pain, as well as a normalization of circadian rhythms and hormonal balancing. By recommending Genesis Gold with extra sacred 7 amino acids for at least a few months for my most severely affected, my chronic fatigue syndrome patients are able to get their lives back. Now, if you have any questions about chronic fatigue syndrome and hypothalamus dysfunction, please join us in our hormone reboot training. And you can learn more in my newest book, The Hypothalamus Handbook. I'll see you in the next video.